When you arrive for each appointment with me, you will first fill out a form that looks something like this, where you'll have the opportunity to outline what you're feeling and where you're feeling it, as well as what are your needs and expectations for that day's treatment. Next, we'll decide together where to start. I will probably have you stand in front of me while I evaluate your posture. By looking at the way you stand, I can obtain a lot of valuable information about where and how restrictions in your fascial web are pulling your skeletal structures off balance. For example, I'll evaluate your pelvis to see if it's rotated or if one hip is higher than the other. I'll look at your legs and feet to see if one or both of your legs are rotated in or out. I'll check to see if one of your shoulders is higher or lower than the other, or if your head is tilted to one side. Using this information, combined with what you've already told me that you're feeling, I can get a really good idea about what's going on inside your body and where might be the best place to start that day's treatment. Once I have a starting point, I'll instruct you to sit or stand or lie on a treatment table in an appropriate position that will allow me to access the fascia in that area. Then I'll place my hands on your body in such a way that I can engage the barrier of the restriction in that place. I'll use gentle pressure first, and then I'll move my hands slightly in order to impose some gentle traction on the underlying structures. Or, depending on the target, I might just gently pull one of your arms or legs until I reach the barrier. Then we simply wait for the restriction to release. It may take 2 or 3 minutes or more, and if you're paying attention, you might start to feel movement under your skin. It might happen directly under my hands, or it might take place somewhere distant from where I'm working. You might experience the release as a sudden softening or stretching sensation, like melting butter or pulling taffy, or it might feel like twitching, tingling, or temperature changes. Some people even experience sudden strong emotions, which is also an indication that the fascia is letting go of energy that has been trapped within the restrictions. Everyone's experience with this will look and feel a little different, and there's no way that either of us can predict, even from one treatment to another, exactly how it will happen. When restrictions release, you may have a realization about exactly which past injury is being healed and released, or you may have no idea. The fact is that it doesn't matter, and nobody needs to know. Your body knows. All you have to do is trust that your body knows what it's doing, and be sure that you're keeping your head out of the way of the process. I'll be helping you do that, and it may not be as difficult as it sounds. Now, in extreme cases where there's severe pain or broken bones or open wounds, it may not be possible to apply even gentle pressure in that area. In cases like that, it's possible to provide treatment to an area that's quite some distance away from the problem, and you'll still experience relief. Understand that the fascia is a single organism, and it's all connected into one giant system, and it's not possible to affect one part of the system without affecting the entire system. Also, during the treatment, I'll be scanning your body for signals from your fascia regarding other restrictions that need to be released that are away from the point where we decided to start working. Your body will communicate with me in the form of vasomotor responses, which are areas that become hot or that turn flush during the treatment. To illustrate, you can create a vasomotor response on yourself just by applying some pressure with your fingertips for a few seconds and then letting go. You'll see how the area becomes flush and blotchy for several seconds afterwards. That's what a vasomotor response looks like. However, the vasomotor responses that I'll be looking for are the ones that show up spontaneously during the treatment, where I haven't been touching you. This is how your body creates a roadmap for me to follow as I'm providing the treatment. This is what it means for a treatment to be holistic. It means that your body is dictating the treatment and your body is doing all the work. My job is to simply hold the space for healing to take place. Your job is to relax and keep your head and your ego from interfering with the work, and your body does the rest. At first, it can seem very surreal, but once you get used to it, you realize that there's nothing unnatural about it. It feels completely normal and also very familiar on some level. And you realize that you remember experiencing this type of healing spontaneously before. Perhaps while you were in bed on the verge of sleep, or just chilling on the couch and watching television. You just may not have recognized what was happening before. But after receiving this work, you will recognize it for what it is, and you will have a better understanding about your role in assisting your body in this natural healing process. During most of your treatment, we will both be very silent. It's important for both of us to be completely tuned into your body and what is taking place under your skin. So it's important to minimize distractions as much as possible. I will also encourage you to minimize your voluntary movements, but also to take off the brakes, so to speak, so that your body is free to unwind with involuntary movements as much as it needs to. These involuntary movements don't happen to everyone, or even necessarily during every treatment, but you might experience them as twitching or as sleepy jerks, as I like to call them, or in other ways. Some people give me weird looks when I start describing the unwinding process, like I'm describing a demonic possession or something. But I assure you that it's nothing weird or scary, and the first time you experience it, you realize that it's a perfectly natural response, no more weird or scary than a tummy that starts rumbling after a large meal. If you've signed up for my intensive treatment series, I will also occasionally make time to teach you some of the ways that you can unwind yourself at home. I'll do my best to make sure that you have as many tools as you need to continue your treatment every day if necessary, in the comfort and convenience of your own home. In many cases, your self-treatment can even take place while you're relaxing in bed. Not only is it quick and easy, but it's also enjoyable and it feels amazing.